Before we get started, if you're a returning viewer but haven't subscribed, hit that subscribe button. It allows my videos to reach more people. Also, comment down below some topic ideas you're interested in seeing. That's all from me. Let's get started. There's a moment in Season 4, Episode 5, Interment, that still haunts me. Herschel moves between the prison cells during the flu outbreak, and you can see him counting pills. Not organizing them, counting them. His hands shake slightly as he divides antibiotics into smaller and smaller portions, trying to make them last, trying to decide who gets treatment and who has to hope their immune system is strong enough. Empty bottles are scattered across the table beside him, their plastic shells catching the dim light. And here's what keeps me up at night. Those bottles represent more than just medicine running low. They represent a timer, counting down on modern survival itself. What happens when the last pill is gone? Let's explore that question together. Back in Season 1, Episode 6, TS19, we saw the CDC for the first and last time. Dr. Jenner ran blood tests on everyone, checked vitals, explained the science of the infection with the kind of clinical precision that felt almost comforting. Here was someone who understood what was happening on a medical level, who had equipment and knowledge and systems. But even then, even in that fortress of science with its backup generators and sealed laboratories, the end was already visible. Jenner had supplies, yes, but they were finite. The infrastructure that created those supplies, the pharmaceutical companies, the manufacturing plants, the distribution networks, all of it was gone. And Rick understood something crucial in those CDC corridors, even if he couldn't articulate it yet. When Jenner showed him the brain scans, explained the infection process, Rick asked practical questions. Not about cures or vaccines, but about survival. How long could they stay? What resources were available? Because Rick was already thinking like a survivor, not like someone waiting for the old world to restart. The hospital scenes from earlier in Season 1 showed us the same truth from a different angle. Buildings already looted, supplies scattered, desperate survivors tearing through medical cabinets looking for anything useful. Shane and the others had grabbed what they could in those early days, but think about what that means. Every bottle of antibiotics, every pain medication, every insulin vial that survived the initial outbreak, that's it. That's the entire supply for the rest of human existence, unless someone rebuilds the infrastructure to make more. Here's the pattern that emerges when you look at Season 1 carefully. Medical knowledge versus depleting resources. Jenner had knowledge, but limited supplies. The hospital had supplies, but no one with knowledge to use them properly. And scattered survivors had neither. The apocalypse didn't just kill people. It killed the entire system that kept people alive through modern medicine. Rick protecting Carl becomes a different kind of fear when you realize there are no antibiotics available if Carl gets a serious infection. No emergency rooms to rush to. No pediatric specialists. Just whatever they've managed to scavenge and whatever knowledge they have among themselves. And in Season 1, that knowledge is pretty limited. They're cops and housewives and office workers, not doctors or nurses or pharmacists. So here's my question for you. How long could scavenged medication realistically last? If the outbreak happened in 2010, and survivors are looting pharmacies and hospitals and homes, how many years of medication are they finding? And more importantly, what happens when those supplies run dry? Season 2 at Herschel's farm shows us the next phase of this medical crisis, though it's easy to miss if you're focused on the barn full of walkers or the search for Sophia. Herschel was a veterinarian, and that detail matters more than the show explicitly states. He had medical knowledge, But it was animal medicine close enough to help with emergencies, but not the same as having an actual physician. When Carl gets shot in episode 1 of season 2, What Lies Ahead, the desperation becomes visceral. Shane and Otis have to raid a FEMA shelter for surgical supplies because Herschel doesn't have what he needs, even with his veterinary equipment. They're performing emergency surgery on a kitchen table with scavenged supplies and hoping it's enough. No anesthesiologist, no sterile operating room, no blood bank for transfusions. Just knowledge, improvisation, and luck. And it works. Carl survives. But think about what had to align for that to happen. Herschel's medical knowledge, the FEMA supplies being intact and accessible, Shane and Otis succeeding in their run, Carl's young body being resilient enough to survive the trauma and subsequent surgery. Remove any one of those factors, and Carl dies. That's the new reality of medical care. Laura's pregnancy, visible throughout Season 2 and into Season 3, is foreshadowing something terrible. She's pregnant without prenatal care, without vitamins designed for fetal development, without regular checkups or ultrasounds. Herschel can offer advice based on his veterinary experience with birthing animals, but human pregnancy is different, more complicated, more dangerous without modern medical intervention. The show doesn't dwell on this, but it's there in the background. Laurie's anxiety about the pregnancy isn't just about raising a child in the apocalypse, it's about surviving the birth itself. And her fears are completely justified, as we'll see later. Here's the pattern in Season 2. Medication abundance from scavenging. But that abundance is deceptive. The farm is relatively untouched, protected by Herschel's delusion that the walkers are sick people who can be cured. So their medicine cabinets are still stocked. The FEMA shelter still has supplies. The veterinary college where Otis worked probably has more. But all of this is scavenging, taking what was made before the outbreak. None of it is renewable. And here's where I need to point out something the show trusts us to know, but never explicitly states. Antibiotics expire. Most antibiotics have a shelf life of 2 to 3 years. Some medications last longer if stored properly cool, dark, dry conditions. But many break down, become less effective, or even dangerous over time. So even if survivors find a fully stocked pharmacy in Season 2, by Season 4 or 5, most of those medications are past their expiration dates. They might still work at reduced potency, or they might not work at all. And there's no way to manufacture more, no way to test potency, no quality control systems. You take what you find and hope it's enough. The farm era represents the last moment when medical supplies felt abundant. After the farm falls in Season 2, Episode 13, Beside the Dying Fire, that abundance disappears. They're back on the road, back to rationing, back to having to weigh whether using antibiotics for a minor infection is worth depleting their limited supply. Season 4, Episodes 4 and 5, showed us what happens when medication truly runs short. The flu outbreak at the prison is one of the most medically realistic storylines in the entire series, and it's terrifying precisely because it's so plausible. A respiratory illness spreads through a confined population. People get sick, some die, and the survivors are faced with an impossible choice. How do you allocate limited antibiotics? Herschel moves through those cells like a battlefield medic during triage, deciding who gets treatment and who has to fight the infection on their own. And you can see it breaking him, that choice. Every decision about who receives medication is a decision about who might die without it. But here's what makes Herschel's response so important. He doesn't just rely on the antibiotics. He makes elderberry tea. He uses natural remedies, herbal treatments, that people used before modern medicine existed. It's not ideal. Elderberry tea won't cure bacterial pneumonia the way antibiotics will. but it's something. It provides comfort, maybe boosts immune function slightly, and critically, it doesn't deplete the medication supply. This is the moment when the show acknowledges what's coming. Herschel knows, even if he doesn't say it explicitly, that they're approaching the end of the antibiotic era. So he's preparing for what comes after, teaching people about natural remedies, sharing knowledge that will matter when the pills are gone. Meanwhile, Daryl, Michonne, Bob, and Tyrese go on a desperate run to a veterinary college 50 miles away. The risk they take leaving the prison understaffed, traveling through walker-infested territory, nearly dying multiple times, all for a single supply of antibiotics from an animal hospital. That's how dire the shortage has become. They're not raiding human pharmacies anymore because those have been picked clean. They're going after veterinary supplies, hoping that animal antibiotics will work for human infections. And they succeed. They bring back the medication, and many of the sick survivors recover. But this is approximately 2 years post-outbreak, maybe less. They're already reduced to raiding veterinary colleges. What happens in year 5, year 10? The emotional weight of the flu outbreak isn't just about who dies, though plenty of people do, including several characters we've come to care about. It's about watching Herschel make impossible choices. Choosing who gets antibiotics means choosing who has the best chance of survival, but it also means accepting that others will die without treatment. That's a burden no one should carry, but in the apocalypse, someone has to. There's this scene where Herschel sits alone for just a moment, surrounded by empty pill bottles. He's exhausted, physically and emotionally spent from caring for the sick, and he picks up one of those bottles, turns it over in his hands, and you can see him calculating. How many people did this bottle save? How many more bottles do we have? How long until we run out completely? The show doesn't give us that internal monologue, but we can see it in Scott Wilson's performance. Herschel knows. He knows the timer is counting down. So here's the theory seed I want to plant. The flu outbreak in Season 4 is 2 years post-outbreak. By Season 11, it's 12 years or more into the apocalypse. What happens in year 5 when the antibiotics from the veterinary college have expired? What happens in year 10 when even carefully stored medications have degraded? What happens when the knowledge of how to treat infections is still there, but the tools to do so are gone? That's what we're building toward. That's the quiet crisis underneath the walker threats and human conflicts. The medication is running out, and there's no way to make more. Here's something the show never directly addresses, but becomes obvious when you pay attention. Where are all the people with chronic conditions? Where are the type 1 diabetics who need daily insulin injections? Where are the severe asthmatics who require inhalers? Where are the epileptics who need anti-seizure medication to prevent potentially fatal seizures? They're not there. They're absent from the narrative, and that absence tells a story more brutal than any walker kill. Type 1 diabetes is a death sentence in the apocalypse. Insulin needs to be refrigerated, and it has a shelf life of about 2 to 3 years, even when properly stored. After the outbreak, maybe survivors find stockpiles in pharmacies or hospitals. Maybe they even find working refrigerators in the early days when some areas still have power. But insulin production requires sophisticated pharmaceutical manufacturing. No one's making more. So a type 1 diabetic survives maybe a few years into the outbreak, if they're incredibly lucky and keep finding insulin. But by year 3 or 4, that insulin is degraded or gone. And without insulin, diabetic ketoacidosis sets in. It's a slow, painful death that takes days. There's no dramatic walker bite, no heroic last stand. Just a quiet tragedy of a survivable condition becoming fatal because the medication doesn't exist anymore. Asthmatics face a similar timeline. Inhalers don't require refrigeration, but they have a limited shelf life, usually 1 to 2 years. Severe asthmatics who rely on daily controller medications and rescue inhalers are in serious trouble once those run out. Environmental triggers are everywhere in the apocalypse. Smoke from fires, dust from collapsed buildings, stress that can trigger attacks. Without medication, a severe asthma attack can be fatal. We actually see a reference to this in Season 4, when Beth and Daryl search for supplies. Beth specifically looks for her father's insulin needs at the veterinary college, suggesting Herschel or someone in the prison population required diabetes management. But we never see this person. They're not part of the main cast, which means either they died before we met them or they died quietly off-screen when their medication ran out. Epileptics, people with seizure disorders, face similar challenges. Anti-seizure medications prevent potentially fatal seizures, but those medications need to be taken consistently. Miss a few doses, and breakthrough seizures become likely. In the apocalypse, a seizure at the wrong moment during a walker attack, while on watch, while driving, can be deadly, even if the seizure itself isn't. The pattern here is heartbreaking. People with chronic conditions that are completely manageable in the modern world become survival risks in the apocalypse. And it's not because they're weak or incapable. It's because the pharmaceutical infrastructure that kept them alive doesn't exist anymore. Think about what this means for the survivor population we see on screen. Everyone we meet is essentially in the upper tier of genetic health. They don't require daily medications to survive. They don't have chronic conditions that need management. They're the ones who could survive without the pharmaceutical industry. This creates a survivor bias in the narrative. The people we see aren't representative of the pre-apocalypse population. They're the ones who happen to have the genetic luck of not requiring ongoing medication. Everyone else, the diabetics, the asthmatics, the epileptics, people with thyroid disorders or heart conditions or mental health needs, they didn't make it past the first few years. And here's the question that haunts me. They needed daily medication. Where did they go? We know the answer. They died. Not dramatically, not heroically, but quietly as their medication supplies dwindled and then ran out entirely. The apocalypse didn't just kill people through walker bites. It killed them through the absence of the medical infrastructure they depended on to live. That's the invisible crisis, the one the show doesn't focus on because those people aren't there to focus on. They're already gone. When Rick's group arrives in Alexandria in Season 5, one of the first things we notice is how clean everything is. The houses have power. The water runs. And critically, the medicine cabinets are still stocked. This is a community that's been protected since the early days of the outbreak, and that protection meant their supplies lasted longer. Denise Cloyd is introduced in Season 5, Episode 15, as a psychiatrist, not a surgeon or emergency physician. But in Alexandria, she's the closest thing they have to a doctor, so she becomes their doctor by necessity. She has to learn surgery from medical textbooks, has to figure out trauma care on the fly, has to become something she was never trained to be because the alternative is having no medical care at all. There's something both inspiring and tragic about Denise's arc. She rises to the challenge, learns as much as she can, saves lives through sheer determination and study. But she's also terrified most of the time. You can see it in her hands when she operates, in her voice when she's unsure about a diagnosis. She knows she's not qualified for what she's doing, but she does it anyway because people need her. Pete Anderson, abusive and alcoholic, was Alexandria's actual surgeon before Rick kills him. And here's the terrible practicality of the apocalypse. Pete's medical expertise made him valuable, even though he was a monster. The community tolerated his abuse because they needed his skills. That's the calculus of survival. Sometimes you keep the surgeon alive even when he doesn't deserve it, because losing medical knowledge is too costly. Alexandria's medicine cabinets tell a story through inventory. They still have antibiotics in Season 5, about 3 to 4 years post-outbreak. They have pain medications, antiseptics, surgical supplies, but watch the background carefully in later seasons, and you'll notice those supplies dwindling. By Season 7 and 8, the medical supplies are more carefully rationed. By Season 9, they're relying more on natural remedies and preventative care because the pharmaceutical supplies are running low. The pattern here is that walled communities preserve medication longer because they have security. They're not constantly losing supplies to raids or having to abandon caches when they flee. They can store medications properly, ration them carefully, use them only when necessary. But even with perfect storage and careful rationing, medications degrade. Chemistry doesn't care about your survival needs. There's a scene in Season 7 where Rosita needs treatment for an infection, and you can see Denise carefully measuring out antibiotics, not generous doses, measured minimal doses. Just enough to fight the infection without wasting any. That's how precious these supplies have become. Every pill is counted, every dose calculated to use the minimum effective amount. This is maybe 4 or 5 years into the outbreak, and already they're rationing antibiotics like gold. What does that tell us about the timeline? It tells us that even Alexandria, with its protected supplies and careful management, is approaching the end of their pharmaceutical stockpile. The emotional weight of this isn't in dramatic moments. It's in the quiet calculations. Denise deciding how much antibiotic to prescribe. Carol learning which herbs can be used for which ailments. Rick establishing supply runs specifically for medical supplies because they're becoming more critical than food. Security equals medical access in the apocalypse. The communities with walls and defenses can protect their medication caches. They can prevent looting, prevent waste, prevent the kind of desperate scavenging that leads to supplies being damaged or lost. But walls can't stop chemistry. They can't prevent medications from expiring or degrading. So Alexandria had an advantage, several years' worth of advantage. But that advantage is temporary. The timer is still counting down, just more slowly than for people on the road. And here's what makes Denise's death in Season 6, Episode 14, twice as far so devastating beyond the loss of a beloved character. She represented institutional medical knowledge. She was learning, growing as a physician, accumulating practical experience. When she dies, that knowledge dies with her. Sure, there are medical textbooks, but books can't replace hands-on experience and judgment developed through practice. Every medical professional who dies represents an irreplaceable loss, not just to their community, but to the future possibility of rebuilding medical infrastructure. And they're all vulnerable, because in the apocalypse, everyone is. Season 3, Episode 4, Killer Within, shows us what childbirth looks like when medication runs out. Lori goes into labor during a walker attack, and the baby is in breech position. Maggie has to perform an emergency C-section with a knife. No anesthesia, no surgical tools, no antibiotics to prevent post-surgical infection. Lori knows she won't survive. She says goodbye to Carl, tells him to take care of the baby, and dies during the procedure. This is what maternal mortality looks like in the apocalypse, A completely survivable complication breech position becomes a death sentence because they don't have the medical infrastructure to handle it safely. In the modern world, a breech baby means a scheduled C-section in a sterile operating room with anesthesia and antibiotics and a full surgical team. In the apocalypse, it means a desperate field surgery that kills the mother. Fast forward to season 9, and Maggie is pregnant. She's at Hilltop, and she has Siddiq, who has actual medical training and knowledge. When Maggie gives birth to Herschel Jr., she survives. The baby survives, but think about how much had to go right for that outcome. Maggie's pregnancy had to be uncomplicated. The birth had to proceed normally. Siddiq had to be available and skilled enough to handle any complications. The contrast between Laurie's death and Maggie's survival isn't about courage or strength. Both women were equally strong. It's about medical knowledge and circumstances. Laurie had an emergency complication during a crisis with no trained medical help. Maggie had a normal pregnancy with a trained medical provider in a stable community. That's the difference between life and death. But here's what the show's teaching us through these births. Every pregnancy in the apocalypse is now a life-threatening risk. Maternal mortality in the modern world is relatively rare, about 17 deaths per 100,000 live births in the United States before the outbreak. In medieval times, it was closer to 1 in 100. Without modern obstetrics, without antibiotics, without blood transfusions and emergency surgical capabilities, we're back to medieval survival rates. Would you risk pregnancy in this world? That's not a hypothetical question. It's a genuine ethical consideration for survivors. Every pregnancy might result in the mother's death. Every birth might leave a child orphaned, and a community loses valuable members when women die in childbirth, members who have survival skills and knowledge and irreplaceable value. Season 9, Episode 8, Evolution, shows us another aspect of this medical crisis. Aaron's arm gets crushed and infected during a storm. The only way to save his life is amputation, and they have to do it without proper anesthesia. Enid and Siddiq perform the surgery while Aaron is conscious, biting down on something to handle the pain. It's medieval, it's brutal, and it's the new normal. Think about what that scene represents. In the modern world, a crushed arm means emergency surgery, antibiotics to prevent infection, pain management, physical therapy for rehabilitation. In the apocalypse, it means amputation without anesthesia, because they don't have the antibiotics to fight the infection that's already set in. They don't have the luxury of trying to save the limb. It's amputate or die. Aaron survives, but he's permanently disabled now. He has to relearn how to fight, how to function, how to survive with one arm. And he does it because he's Aaron and he's resilient. But the cost is enormous, not just physically, but psychologically. Every major medical event now carries this weight. A broken bone might not set properly without x-rays and proper orthopedic care, leaving someone with a permanent limp or disability. A serious infection might require amputation because they don't have the antibiotics to treat it medically. Childbirth might kill the mother because they can't handle complications. The emotional anchor in these scenes is always the same: silence, helplessness, and improvised tools. Maggie, performing surgery on Laurie with a knife. Enid and Siddiq amputating Aaron's arm with a bone saw. The silence of knowing there's no other option. The helplessness of having medical knowledge but not medical supplies, and the crude tools that are all they have to work with. These aren't dramatic action sequences. They're quiet tragedies that happen because the pharmaceutical infrastructure is gone, because antibiotics have run out or degraded, because the medical supplies that would make these procedures safe and survivable simply don't exist anymore. And every single person in every community knows if something happens to them, if they get sick or injured, this is what medical care looks like now. Desperate improvisation with whatever supplies remain and hope that it's enough. Season 11 brings us to the Commonwealth, and on the surface, it looks like they've solved the medical supply problem. They have a functional hospital. They have doctors and nurses. They have medical procedures and treatments that other communities can't access. But look closer, and you'll see that even the Commonwealth is just rationing what remains, not creating anything new. Pamela Milton's class system extends into medical care, and nowhere is this more visible than in Ezekiel's storyline. He has a thyroid tumor, something completely treatable in the pre-apocalypse world. You'd have surgery, remove the tumor, maybe radiation or medication to follow up, and you'd be fine. Survival rate for thyroid cancer is over 90% with proper treatment. But Ezekiel isn't upper class in the Commonwealth. He's a worker, and when he seeks treatment, he's told that surgery isn't available for him, not because the Commonwealth lacks surgeons or operating rooms, they have both, but because medical care is rationed based on social status, and Ezekiel doesn't rate high enough to receive surgery for a non-essential condition. Think about what that means. The Commonwealth has preserved medical infrastructure, but they've weaponized access to it. The rich get treatment. The poor get to suffer with treatable conditions until those conditions become fatal. It's not a medical decision. It's a political one. This is the ultimate evolution of medication scarcity as a class divider. In earlier seasons, everyone was scrambling for the same limited supplies, but in the Commonwealth, there's a system. There are administrators and boards and processes for determining who receives care, and those systems are designed to preserve the existing power structure. If you're valuable to Pamela Milton's administration, you get medical care. If you're not, you don't. The hospital itself is a symbol of what's been preserved and what's been lost. They have functioning equipment, probably solar-powered or with working generators. They have trained medical staff who've maintained their skills. They have supplies that have been carefully hoarded and rationed over the years. But they don't have manufacturing capabilities. They can't make new antibiotics or surgical supplies or medications. They're still drawing from the stockpile that existed when the outbreak began. And here's the terrible math. The Commonwealth has 50,000 people. Even with careful rationing, even with restricting access through class systems, those supplies are finite. Every surgery uses supplies that can't be replaced. Every prescription depletes stocks that can't be replenished. The Commonwealth is playing the same game as everyone else. Make it last as long as possible. They just have more to start with. Ezekiel's denied surgery becomes a test case for the theory we're building. If he survives without medical intervention, it might be through natural remission or the tumor being benign. If he dies, it proves that even in the most medically advanced community in the apocalypse, treatable conditions become fatal when access to treatment is denied. But there is a darker question underneath this. Even if Ezekiel were upper class and received the surgery, what happens to the next person who needs thyroid surgery? And the one after that? Every medical procedure depletes non-renewable supplies. Eventually, even the Commonwealth will run out. The pattern we're seeing is that medicine becomes the ultimate class divider when it's scarce. Food can be grown. Water can be found. Shelter can be built. But medicine? Medicine requires complex chemical synthesis, quality control, sterile manufacturing environments. It requires an industrial base that doesn't exist anymore. So the people who control access to the remaining medical supplies control life and death itself. Pamela Milton doesn't just control the Commonwealth's government. She controls who lives and who dies based on who gets medical treatment. Rich survivors get antibiotics for their infections. Poor survivors die of treatable pneumonia. Rich survivors get surgery for their tumors. Poor survivors die of treatable cancers. It's not about medical need. It's about social value, as determined by the people in power. And here's what makes this particularly insidious. The Commonwealth presents this as rational resource management. They frame it as necessary triage given limited supplies. But it's not triage prioritizes based on medical need and likelihood of survival. This is rationing based on class, which is just another word for deciding some lives matter more than others. The emotional weight here isn't in any single dramatic moment. It's in the realization that even in the most advanced community in the post-apocalypse world, medical care has become a privilege rather than a right. That even with preserved hospitals and trained doctors, the lack of pharmaceutical manufacturing means people will die of treatable conditions. But even the Commonwealth can't manufacture new medications. They're still living on borrowed time, just like everyone else. The stockpile is larger, but it's still finite. And when it runs out, when even the Commonwealth's carefully hoarded supplies degrade past usefulness, what then? Let me lay out the core theory as clearly as I can, based on everything we've observed across 11 seasons. Most medications expired between year 3 and year 5 post-outbreak. And by the time we reach season 11's timeline, 12 or more years into the apocalypse, the pharmaceutical era is effectively over. This isn't speculation. This is chemistry and math. Antibiotics, the foundation of modern medicine's ability to treat infections, typically have shelf lives of 2 to 3 years. Some last longer under ideal storage conditions, cool, dark, dry environments. But even with perfect storage, chemical compounds degrade, the molecular structure breaks down, potency decreases, and in some cases, degraded antibiotics can become toxic. Insulin, absolutely critical for type 1 diabetics, must be refrigerated and lasts about 2 to 3 years even when properly stored. After power grids failed, after refrigeration became impossible to maintain consistently, insulin supplies would have degraded rapidly. By year 3, maybe year 4 at the absolute latest, every insulin vial in the apocalypse would be useless. Chemotherapy drugs, immunosuppressants, anti-seizure medications, antipsychotics. These complex pharmaceutical compounds have similar timelines. Some are more stable than others, but none last forever. And none can be manufactured without sophisticated chemical synthesis capabilities. So here's the timeline as I understand it. Year 1 of the outbreak. Medication is abundant. Survivors are looting pharmacies, hospitals, nursing homes, finding stockpiles everywhere. Year 2. Supplies are getting harder to find, but still available. Year 3. People are raiding veterinary colleges and rural clinics for what remains. Year 4 and 5. Most medications are past their expiration dates, and survivors are using degraded supplies of questionable potency. By year 12, where we are in season 11, what's left? Some antibiotics, probably. The most stable ones, if stored in cool, dry conditions, might retain some potency. Not full strength, but enough to help with infections if you increase the dosage. Basic pain medications like aspirin might still be around, as they're relatively stable compounds. Topical antiseptics, bandages, basic medical supplies that don't degrade as quickly. But what's gone? Insulin completely gone. Any diabetic who survived the first few years is dead now. Chemotherapy drugs gone. Anyone with cancer has no treatment options. Anti-seizure medications expired. Epileptics have no way to control their condition. Antipsychotics degraded. People with serious mental health conditions have no pharmaceutical management options. The character cost of this timeline is staggering. Anyone dependent on these medications is already dead. We don't see them in the communities we visit because they didn't survive past year 3 or 4. The survivor population we see in season 11 represents genetic selection people who happened to not need daily medication to live. This is why the communities we see are smaller than we might expect. It's not just walker deaths and violence and accidents. It's the quiet attrition of people who needed medicine that no longer exists. A diabetic who runs out of insulin. An asthmatic who can't get inhalers. An epileptic who has a fatal seizure. They're not part of the narrative because they're gone. And here's what this means for the communities that remain. They're operating at a pre-antibiotic level of medical care. They're back to methods from the 1800s, herbal remedies, natural treatments, surgical amputation to prevent spread of infection because they can't treat infections medically. Siddiq's use of natural remedies in seasons 9 and 10 isn't supplementary medicine, it's primary medicine. Elderberry for immune support, willow bark for pain and fever, herbal poultices for wound care. These are the treatments available now because pharmaceutical options are gone or nearly gone. The Commonwealth might have a few more years of pharmaceutical supplies due to their hoarding and rationing, but the trajectory is the same. They're running out. Every surgery, every prescription, every use of antibiotics depletes a non-renewable resource. What's truly devastating about this timeline is that the knowledge to create these medications still exists. There are probably people in various communities who know the chemical formulas, who understand the synthesis processes, but knowledge without infrastructure is useless. You can't manufacture antibiotics in someone's basement. You need sterile environments, pure chemical reagents, quality control systems, industrial-scale production capabilities, all of which require an industrial base that no longer exists. So we have a population that knows modern medicine exists, that understands what's possible with the right medications, but can't access those medications because they can't be made anymore. That's a special kind of tragedy, knowing that people are dying of completely treatable conditions, having the knowledge to treat them, but lacking the tools to do so. This theory explains so much about what we see on screen. Why communities are desperate for anyone with medical knowledge. Why medical supplies are worth risking lives on dangerous runs. Why infections are treated so seriously. Why every injury carries the threat of death. It's not just about walkers anymore. It's about surviving in a world where a simple infection can kill you, where chronic conditions are death sentences, where childbirth might cost the mother's life. The timer has run out, the medication is gone, and we're seeing what survival looks like on the other side of that reality. Here's what I think happens next, based on the patterns we've seen and the trajectory the show has established. Communities that survive long-term will be the ones that successfully return to pre-modern medical practices while preserving what medical knowledge they can. Think about what Herschel did during the prison flu outbreak. He didn't just rely on the limited antibiotics they had. He made elderberry tea. He used herbal remedies that people employed before antibiotics existed. That knowledge, that understanding of botanical medicine, becomes critical when pharmaceutical options disappear. Carol has shown interest in foraging and natural remedies throughout the series. Siddiq explicitly used herbal treatments in later seasons. These aren't quaint survivalist hobbies anymore. This is the future of medicine. Communities need people who understand which plants have medicinal properties, how to prepare them, how to dose them safely. My theory is that future storylines, whether in remaining episodes or spin-offs, will increasingly show medieval-level medical practice. Not because people have forgotten modern medicine, but because modern medicine requires tools they don't have anymore. Surgery without anesthesia, like we saw with Aaron's arm. Amputations to prevent infection spread because antibiotics aren't available. Herbal remedies for pain and inflammation. Quarantine as the primary method of controlling infectious disease. Childbirth mortality is going to return to historical levels, which is horrifying to contemplate. In the 1800s, about 1 in 100 births resulted in the mother's death. Without modern obstetrics, without antibiotics to prevent post-birth infections, without the ability to handle complications surgically, that's the reality communities face. Every pregnancy becomes a calculated risk. Amputations will become more common, just as they were before antibiotics. A leg infection that could be cured with a course of antibiotics now means amputation to save the person's life. We've already seen this with Aaron. We'll likely see more of it as infections that would have been treatable become life-threatening. The communities that thrive will be the ones that develop apprenticeship systems for medical knowledge. Siddiq was training others before his death in Season 10, Episode 7. That's the model that has to continue. Medical knowledge can't be concentrated in 1 or 2 people. It's too vulnerable to loss when those people die. It needs to be distributed, taught, passed down through practical training. Carol learning field medicine. Rosita learning how to treat wounds and set bones. Younger characters learning from the few remaining people with medical training. This is how medical knowledge survives when you can't build medical schools or print new textbooks. Direct apprenticeship, practical training, learning by doing, under the guidance of someone more experienced. But here's the limitation. You can train people in surgical techniques, in how to recognize diseases, in treatment protocols. But without the tools, without antibiotics and anesthesia and sterile equipment, that knowledge has limited application. You can teach someone how to perform an appendectomy, but if they don't have antibiotics to prevent post-surgical infection, the patient might die anyway. So the next generation of medical practitioners in the Walking Dead universe will be trained in pre-antibiotic surgery. They'll learn techniques that prioritize speed over precision because the patient needs to be conscious and can't tolerate prolonged procedures. They'll learn amputation as a primary treatment for limb infections. They'll learn herbal pain management because pharmaceutical options don't exist. It's simultaneously a preservation of knowledge and a return to practices we'd abandoned as barbaric in the modern era. But barbaric or not, it's what's possible given the resources available. Think about what medical knowledge you'd want in this scenario. Not how to prescribe antibiotics you don't have antibiotics. Not how to read an MRI you don't have an MRI machine. You'd want to know which plants can reduce fever, how to set a broken bone without x-rays, how to perform surgery with minimal tools, how to recognize which infections will likely resolve on their own and which require intervention. This is survival medicine. It's not about optimal care, it's about keeping people alive with whatever tools are available. The emotional weight of this shift is enormous. Imagine being Siddiq, trained in modern medicine, knowing exactly what treatment a patient needs, and being unable to provide it because the medications don't exist. That's not just frustration, that's moral injury. It's the wound of knowing you could save someone if only you had the tools you were trained to use. Or imagine being a patient, knowing that your infection could be cured with a course of antibiotics that no longer exist. Knowing that you might die from something completely treatable, simply because the treatment isn't available anymore. That's a different kind of apocalypse, not the sudden terror of walker attacks, but the slow despair of treatable conditions becoming fatal. The theory I'm building is that the post-pharmaceutical apocalypse is actually more deadly than the walker apocalypse, but it's quieter. People don't die dramatically. They die from infections, from complications during childbirth, from chronic conditions that are no longer manageable. And the communities that survive will be the ones that successfully adapt to this new medical reality. Medieval-level medicine isn't a failure. It's an adaptation. It's humans doing what humans have always done, surviving with whatever tools are available, preserving knowledge even when they can't fully apply it, and hoping that someday, somehow, the infrastructure to practice modern medicine might be rebuilt. But that rebuilding, if it happens at all, is generations away. For now, for the survivors we follow in the show, this is the reality. Surgery without anesthesia, childbirth risking the mother's life, infections requiring amputation, and herbal remedies replacing pharmaceutical ones. The medication has run out. This is what comes next. Let me trace who dies when medication ends, because understanding this helps us see why the survivor population looks the way it does. Type 1 diabetics die first, probably within weeks to months of insulin running out. Insulin needs to be refrigerated, and even with refrigeration, it degrades over time. Once power grids fail and refrigeration becomes unreliable, insulin supplies degrade rapidly. A type 1 diabetic without insulin will develop diabetic ketoacidosis, a condition where the blood becomes acidic due to high blood sugar and ketone buildup. It's painful. It takes several days. And without insulin administration, it's fatal. Think about that for a moment. Diabetes is completely manageable in the modern world. People live full, normal lives with type 1 diabetes. But in the apocalypse, it's a death sentence. Not because the person is weak or incapable, but because the medication they need to live doesn't exist anymore. By year 3 or 4 post-outbreak, every type 1 diabetic is dead. There are no exceptions. The medication they needed to survive has degraded past usefulness. Severe asthmatics follow a similar pattern. Mild asthma might be manageable without medication. Avoid triggers, manage stress, hope for the best. But severe asthmatics who rely on controller medications and rescue inhalers are in serious danger once those run out. Inhalers have a shelf life of 1 to 2 years. After that, the medication degrades, the propellant loses pressure, and they stop working. A severe asthma attack without treatment can be fatal. The airways constrict, breathing becomes impossible, and the person suffocates. It's not dramatic, it's terrifying and slow, and there's nothing anyone can do without medication. Environmental triggers are everywhere in the apocalypse. Smoke from fires, dust from collapsed buildings, mold from water damage, stress from constant survival pressure. Every one of those can trigger an attack, and without rescue inhalers, some of those attacks will be fatal. Epileptics face their own timeline. Anti-seizure medications prevent seizures, but they need to be taken consistently. Miss a few doses, and breakthrough seizures become likely. Different types of epilepsy have different risk profiles. Some seizures are relatively harmless, others can be fatal. But here's the critical risk. A seizure at the wrong moment in the apocalypse can be deadly, even if the seizure itself isn't. Have a seizure while on watch duty, and walkers might attack before you recover. have a seizure while driving or running from danger, and the timing kills you. And some types of seizures, status epilepticus, where the seizure doesn't stop, are directly fatal without medication to interrupt them. Anti-seizure medications have varying shelf lives, but most degrade significantly after 3 to 5 years. By season 11's timeline, those medications are long gone. Any epileptic who survived past the early years either has a mild condition that doesn't require daily medication, or they've been incredibly lucky about when and where seizures occur. People with mental health conditions face a different crisis: schizophrenia, bipolar disorder, severe depression. These conditions aren't immediately fatal like diabetes, but they become survival risks in the apocalypse. Antipsychotics and mood stabilizers allow people with these conditions to function, to make rational decisions, to stay grounded in reality. Without medication, someone with schizophrenia might experience psychotic episodes that make survival impossible, paranoia about other survivors, hallucinations during walker encounters, inability to distinguish real threats from imagined ones. Bipolar disorder without medication can lead to manic episodes where someone takes dangerous risks, or depressive episodes so severe that they can't function. These aren't moral failings, they're medical conditions that require medication to manage. But in the apocalypse, without that medication, people with serious mental health conditions become vulnerable both to external threats and to their own internal states. Cancer patients, anyone who required chemotherapy or radiation, face similar timelines. Cancer treatments are complex pharmaceutical compounds with short shelf lives. They need to be fresh, properly stored, administered under medical supervision. By year 3 post-outbreak, those medications are gone or useless. So anyone with cancer either goes into remission spontaneously, which happens but is rare, or they die from their cancer. No treatment options exist. No chemotherapy, no radiation, no surgical removal of tumors in most cases. Cancer becomes the death sentence it was before modern oncology existed. The theory here is brutal, but inescapable. The missing demographics tell the story. We don't see diabetics because they're dead. We don't see severe asthmatics because they're dead. We don't see people with serious mental health conditions or cancer patients or epileptics because they didn't survive past the early years. The Walking Dead universe is a survivor bias world. Everyone we see on screen is part of the genetic lottery winners, people who happened to not require daily medication to stay alive. They're not stronger or better or more deserving. They're luckier. They drew the genetic card that let them survive without pharmaceutical intervention. And that creates a strange sort of privilege that nobody talks about. In the pre-apocalypse world, having a chronic condition was manageable. You took your medication, managed your condition, lived your life. In the apocalypse, those same conditions become fatal. Not because anything changed about the person, but because the infrastructure supporting their survival disappeared. This is one of the quietest horrors of the apocalypse. The people who died not because of walkers or violence, but because their medication ran out. The diabetic who carefully rationed insulin for as long as possible, knowing every injection brought them closer to the day when there would be no more. The asthmatic who counted inhalers and tried not to panic, which only triggered more attacks. The epileptic who knew that every day without medication increased the risk of a fatal seizure. They're not part of the story we see because they're already gone, but their absence shapes everything about the survivor population. The people we follow in the show aren't representative of humanity. They're representative of the specific subset of humanity that could survive without ongoing medication. And understanding that helps us understand what's at stake when medication runs out. It's not just about treating future illnesses. It's about recognizing that the apocalypse has already killed millions of people who, in the modern world, would have lived full lives. The medication ending didn't just change the future. It already changed who survived to see that future. Season 10, Episode 7, Open Your Eyes, shows us Siddiq's death, and the loss is devastating for reasons beyond the personal tragedy. Siddiq represented institutional medical knowledge. He was Alexandria's doctor, their primary medical resource, and he was actively training others in medical care. When he dies, that knowledge dies with him, or at least much of it does. The same thing happened back in Season 6, Episode 14, Twice as Far, when Denise died. She was Alexandria's doctor, still learning, still growing into the role, but accumulating practical experience that couldn't be replaced. Her death meant the loss of everything she'd learned since taking on medical responsibilities. Yes, there were medical textbooks, but books can't replace hands-on experience and clinical judgment. Here's the pattern that emerges. Medical professionals are precious and vulnerable. They're precious because they have knowledge and skills that keep people alive. They're vulnerable because in the apocalypse, everyone is vulnerable. One arrow, one walker bite, one moment of bad luck, and years of medical knowledge disappears. This creates a crisis of knowledge preservation. How do you keep medical knowledge alive when the people who hold that knowledge can die at any moment? The answer is apprenticeship training multiple people so that the knowledge is distributed rather than concentrated in one or two individuals. We saw hints of this with Siddiq training Enid before her death, and later training Dante, who turned out to be a Whisperer spy, but that's another issue. The principle is sound. You can't afford to have just one doctor. You need multiple people with medical training so that if one dies, the community doesn't lose all medical capabilities. My prediction for future storylines is that apprenticeship systems will become formalized. Communities will recognize that medical knowledge is too valuable to leave concentrated in one person. They'll train multiple people in basic medical care, creating a network of medical providers with varying levels of expertise. Carol has shown interest in and capability with medical care throughout the series. She's learned first aid, helped with injuries, assisted in medical emergencies. Rosita similarly has picked up medical skills over the years. These aren't trained physicians, but they're people with practical knowledge gained through experience. In the post-pharmaceutical world, that practical knowledge becomes critical. You don't need to understand the biochemistry of antibiotics if you don't have antibiotics. You need to understand which wounds are likely to become infected, how to clean and dress those wounds properly, when to consider amputation versus attempting to save a limb. The next generation being trained will learn pre-antibiotic surgery not as a historical curiosity, but as practical skill. They'll learn amputations because that's the primary treatment for limb infections. They'll learn to work fast because patients can't tolerate long procedures without anesthesia. They'll learn herbal pain management because pharmaceutical options don't exist. But here's the emotional weight of this. Imagine being the teacher in this scenario. You know what modern medicine can do. You were trained in modern techniques. But you're teaching people medieval practices because that's what's possible with available resources. You're passing down knowledge while simultaneously teaching its limitations. Or imagine being the student. You're learning medicine, which sounds hopeful and forward-thinking, But what you're actually learning is how to saw off someone's arm while they're conscious and screaming. You're learning which infections you can try to treat and which ones you have to watch kill the patient because nothing you do will help. That's not empowering. That's traumatic. The theory I'm building is that knowledge preservation becomes one of the central survival challenges going forward. Not just medical knowledge, all knowledge. How do you preserve understanding of engineering, agriculture, chemistry, mathematics, when formal education systems don't exist and books are degrading? But medical knowledge is particularly urgent because it's immediately applicable to survival. A community with someone who understands medicine survives at higher rates than one without. That person's knowledge translates directly into lives saved. This creates a moral obligation to preserve and transfer medical knowledge, even when doing so is difficult or traumatic. Siddiq teaching others despite his PTSD from the Whisperer attack. Denise pushing through her fear to learn surgery. Carol learning field medicine despite having no formal training. They do it because the alternative communities with no medical knowledge at all is unacceptable. The emotional weight here is about saving lives versus preventing suffering. With full pharmaceutical supplies, you can usually do both. You can save someone's life and prevent their suffering through pain management and proper care. Without those supplies, sometimes you can save the life but can't prevent the suffering. The amputation saves them, but it's agony without anesthesia. So, medical providers in the apocalypse carry a different burden than modern physicians. They're not just responsible for medical outcomes, they're responsible for the suffering their treatments cause because they don't have the tools to prevent that suffering. Future predictions. We'll see more scenes of medical training, more emphasis on distributing knowledge, more focus on natural remedies and pre-modern techniques. The communities that survive long-term will be the ones that successfully navigate this transition from modern medicine to medieval medicine while preserving as much knowledge as possible for potential future use. Because here's the hope embedded in all of this. Knowledge preserved now might be applicable again someday, if civilization rebuilds enough to recreate pharmaceutical manufacturing. The chemical formulas for antibiotics still exist in textbooks. The surgical techniques for complex procedures are documented. If humanity ever rebuilds the industrial base necessary for modern medicine, that preserved knowledge becomes invaluable. But that's generations away, if it ever happens. For the current survivors, for the next generation being trained now, the reality is medieval medicine, surgery without anesthesia, herbal remedies instead of pharmaceuticals, amputation as primary treatment for infections, and the burden of knowing what's possible while being unable to achieve it because the tools don't exist. Medical professionals in the Walking Dead universe are knowledge keepers in a very literal sense. They keep knowledge alive through teaching, through practice, through passing it down to anyone willing to learn. And they do it knowing that much of that knowledge can't be fully applied given current limitations. That's not futile, that's hopeful in a strange way. They're preserving knowledge for a future they might never see, teaching techniques they can't fully implement, keeping medicine alive even as the tools of modern medicine disappear. And in doing so, they're giving future generations a chance at something better, even if they themselves never experience it. Let's talk about the ethical spiral that medication scarcity creates, because this is where survival gets morally complicated in ways that don't have clean answers. The Commonwealth's approach is explicit triage based on class. Who deserves limited medication? In their system, the answer is people, valuable to Pamela Milton's administration. The useful, the compliant, the ones who maintain the social order. Everyone else gets basic care at best, death from treatable conditions at worst. Is that evil? It's certainly cruel, but it's also rational in a cold, calculating way. If you have limited medications and can't make more, using those medications to preserve people who keep the community functioning makes strategic sense. Lose your engineers, and your infrastructure fails. Lose your farmers, and people starve. Lose your doctors, and you can't treat anyone. The alternative egalitarian distribution, where everyone gets equal access regardless of their role, sounds morally superior, but it means potentially losing critical community members to random medical need. The engineer dies of appendicitis, while antibiotics go to someone whose skills are less essential to community survival. Neither answer is satisfying. Both involve people dying who could be saved if resources were unlimited. That's the ethical spiral. Every choice about who gets medication is simultaneously a choice about who doesn't get it. Negan's saviors operated on similar logic, but more explicitly brutal. The doctor gets resources wasn't just about medical care. It was about recognizing that certain skills are too valuable to lose. Negan's system was monstrous in implementation, exploitative and cruel, but the underlying logic isn't entirely wrong. You do need to preserve people with critical skills. Here's an alternative reading I want to offer. Maybe Negan's system, stripped of its cruelty and exploitation, was more sustainable than the egalitarian approaches other communities tried. Not morally better, it absolutely wasn't, but possibly more practical for long-term survival when resources are severely limited. Think about it. Communities that try to distribute resources equally often collapsed or were absorbed by more ruthless groups. The saviors survived and expanded through brutal efficiency. They identified what they needed, took it, and allocated resources to preserve what made them strong. I'm not defending Negan's methods. The cruelty, the exploitation, the ego-driven brutality. But the underlying calculation about resource allocation and scarcity might have been more clear-eyed than communities that tried to maintain pre-apocalypse ethical standards. Back in Season 4, during the flu outbreak, Herschel faced this choice in miniature. Limited antibiotics, multiple sick people. Who gets treatment? He made medical decisions: who was most likely to survive with treatment, who might survive without it, who was already too far gone. That's legitimate medical triage. But imagine if he'd also had to factor in who is most valuable to the community's survival. That's a different calculation, and a harder one. The moral question underneath all of this: should you ration antibiotics based on medical need or community value? Treat the sickest person first, because they need it most? Or treat the most valuable person first, because losing them hurts the community most? In the modern world, we don't have to make that choice. We have enough antibiotics for everyone who needs them, but in the apocalypse, with limited supplies that can't be replaced, someone has to decide. And any decision means someone dies who might have lived if resources were allocated differently. Here's my question for you. Who would you save with the last antibiotic? The child with a bright future who might contribute for decades? The elderly person with wisdom and experience who teaches others? The doctor whose knowledge keeps everyone healthier? The farmer whose skills feed the community? The fighter who protects everyone from external threats? There is no right answer. Every choice sacrifices someone with value, with relationships, with a life worth living. That's what makes it a true ethical dilemma, not a choice between right and wrong, but a choice between competing goods where every option involves tragedy. The Commonwealth's mistake wasn't recognizing that triage was necessary. It was creating a permanent class system where some lives are structurally valued over others based on birth and social position, rather than contribution or need. That's not triage, that's hierarchy. Legitimate triage evaluates each case individually. Who is this person? What can they contribute? What's their prognosis with treatment? What's the cost of treating them versus someone else? Those are hard questions, but they can be answered with some degree of objectivity. The Commonwealth doesn't do that. They've decided in advance that certain classes of people matter more than others, and medical care is allocated based on that pre-existing hierarchy. That's where survival pragmatism becomes exploitation. But even communities trying to avoid the Commonwealth's mistakes will face these questions. When medication runs out, when you're down to the last doses of antibiotics or pain medication or whatever supplies remain, someone has to decide how they're used. And whoever makes that decision carries the weight of everyone they couldn't save. This is part of what leadership costs in the apocalypse. It's not just making tactical decisions about defense or food distribution. It's making moral decisions about who lives and dies when you can't save everyone. Rick carried this burden. Maggie carries it. Ezekiel faces it when denied treatment himself. The ethical spiral is that there's no way to make these decisions without moral compromise. Try to be fair and egalitarian, and you might lose people critical to community survival. Prioritize community value, and you're deciding some lives matter more than others. Try to avoid making the decision at all, and people die while you hesitate. Maybe the most honest approach is acknowledging that there's no morally clean answer. You do your best, you try to balance medical need with community survival, and you live with the weight of the choices you make. You don't pretend those choices aren't tragic. You don't justify them as anything other than necessary compromises in impossible circumstances. Herschel understood this during the flu outbreak. He made hard choices, and you could see those choices weighing on him. But he made them because someone had to, and he was the one with medical knowledge and moral authority to do so. That's leadership in scarcity. Making terrible choices because the alternative, making no choice, is worse. And carrying the weight of everyone you couldn't save, knowing that if resources were unlimited, they'd still be alive. The medication running out doesn't just create a medical crisis, it creates a moral one. And unlike the medical crisis, the moral crisis doesn't have a solution, just different ways of carrying the burden. So, we come back to where we started. Empty pill bottles scattered across a table. Back in Season 4, during the flu outbreak, those bottles represented hope running out, medicine dwindling, time running short. Now, 12 years into the apocalypse, those bottles tell a different story. They're not markers of scarcity. They're relics of a time when pharmaceutical solutions existed at all. The theory I've built across these chapters is this. Medication scarcity is the silent apocalypse. It doesn't have the visceral drama of walker attacks. It doesn't have the immediate tension of human conflicts, but it's equally lethal, possibly more so over time. People don't die dramatically from medication running out. They die quietly from infections, from complications during childbirth, from chronic conditions that can no longer be managed. It's not spectacular. It's not the stuff of action sequences or dramatic confrontations, but it shapes everything about who survives and how they survive. Think about what this means for the future of the Walking Dead universe. In the spin-offs, in future seasons, the medical landscape is pre-modern. Surgery without anesthesia isn't unusual. It's standard. Amputations to prevent infection spread aren't last resorts. They're primary treatment. Herbal remedies aren't alternative medicine. They're the only medicine available. Communities measure wealth not in stockpiles of medication they don't have, but in medical knowledge they've preserved. A community with someone who knows herbal treatments is richer than a community with a stash of expired antibiotics. Knowledge is renewable. The medications aren't. Ezekiel's tumor storyline becomes a test of this theory. If he survives without surgery, it suggests that some medical conditions resolve without intervention, that the body's own healing capabilities can sometimes be enough. If he dies from a treatable condition because the Commonwealth denied him access to care, it proves that even in the most medically advanced community in the post-apocalypse world, class and politics matter more than medical need. Either outcome reinforces the central theory. We're past the pharmaceutical era. The Commonwealth might have a few more years of carefully rationed supplies, but the trajectory is clear. Eventually, even they run out. But here's an alternative possibility I want to acknowledge. Maybe the CRM, the Civic Republic military that we've seen glimpses of, has manufacturing capability. Maybe they've preserved enough industrial infrastructure to actually produce medications. If that's true, it changes the equation dramatically. Medical care becomes a resource that can be controlled, traded, used as leverage. But even if the CRM can manufacture medications, that doesn't help communities like Alexandria or Hilltop or the Commonwealth unless they can access those supplies. And access likely comes with strings attached, political submission, resource tribute, loss of autonomy, medicine as a tool of control rather than care. The open question that haunts me is, can civilization rebuild without pharmaceuticals? Is it possible to maintain complex society, to organize communities of thousands of people when basic medical care is back to medieval levels? History suggests maybe yes, medieval societies were complex, organized, capable of remarkable achievements despite limited medical care. But they also had higher mortality rates, shorter lifespans, regular epidemic diseases that killed significant portions of the population. Is that acceptable as the new normal? Or does the lack of modern medicine create a ceiling on how complex post-apocalypse society can become? Maybe communities stay smaller, because without pharmaceutical medicine, you can't sustain the population density that allows for specialization and complex economies. These aren't just theoretical questions, they're the reality survivors face. Every illness that would have been easily treatable in the old world is now a potential death sentence. Every pregnancy risks the mother's life. Every injury might require amputation to prevent fatal infection. The emotional close I keep returning to is this. Every survivable illness is now a death sentence for someone. The person who dies of bacterial pneumonia that could have been cured with a course of antibiotics. The mother who dies during childbirth from complications that would have been handled easily in a modern hospital. The child who dies from an infection in a cut that could have been prevented with topical antibiotics. They're not dying because medicine has failed them. They're dying because medicine doesn't exist anymore. The knowledge is there. Medical providers know exactly what treatment would work, but the tools to implement that treatment are gone. That's a unique kind of tragedy. In the pre-modern world, people died of infections and illnesses because humanity didn't know how to treat them. In the post-apocalypse world, people die of the same things, even though we do know how to treat them, but can't because the pharmaceutical infrastructure is gone. Knowledge without tools is its own kind of torture for medical providers. Knowing what would save someone and being unable to do it. Watching people die from treatable conditions. Carrying the weight of all the lives you could have saved if only you had what you needed. But maybe, and this is the sliver of hope I want to end on, maybe survival means remembering what our ancestors knew before pills. Herbal medicine, practical anatomy, botanical knowledge, the accumulated wisdom of thousands of years of humans healing each other without pharmaceutical intervention. It's not ideal. It's not what anyone would choose if modern medicine were an option. But it's what's possible, and humans have survived with far less before. We did it for millennia before pharmaceutical companies existed. Maybe we can do it again. The empty pill bottles aren't just symbols of loss. They're also potentially symbols of transformation. Those bottles get repurposed, we've seen it in the show. Used for seed storage, water collection, small item organization. The plastic shells that once held medication now hold the seeds for next season's crops. Life from death. Use from emptiness. That's very Walking Dead, isn't it? Taking what's been lost and finding new purpose for what remains. The medications are gone. The pharmaceutical era is over. But humanity survives, adapts, finds new ways forward. Not the same ways, not the comfortable ways, but ways nonetheless. And maybe that's the real story. Not what we've lost, but what we're building with what remains. The question isn't whether we can survive without modern medicine. Clearly, we can. Humanity did it for most of our history. The question is what that survival costs, and whether we can preserve enough knowledge that future generations might rebuild what we've lost. I don't have answers, just observations and theories built from patterns in the show. But I think about those empty pill bottles, and I wonder, what will people 12 years from now, 24 years post-outbreak, think when they find them? Will they know what they were for? Will the knowledge of what these small plastic containers once held survive even after the medications themselves are long gone? Maybe survival means remembering. Even when we can't recreate what we've lost, we remember that it existed. We remember what was possible. And we pass that memory forward, just in case someday, somehow, we might build it again. There's an image I keep coming back to, a child's drawing of a hospital with an X through it. Not a sophisticated understanding of what's been lost, just the simple recognition that the building with the red cross, the place that used to mean healing, doesn't work anymore. It's closed. It's over. Beside the drawing, a pill bottle repurposed as seed storage. The prescription label long faded, the plastic scratched and worn, but still useful, still serving a purpose. Inside, seeds for next season's garden. Tomatoes, maybe, or beans. The bottle that once held antibiotics now holds the promise of food, of continuing life in a different form. This is what transformation looks like in the apocalypse. Not dramatic revelations or sudden changes, but quiet repurposing of what remains. The tools of one era becoming the tools of another. Medicine bottles becoming seed storage. Hospital gowns becoming bandages. The physical artifacts of modern medicine finding new uses even as their original purposes become impossible. And somewhere, maybe in Alexandria or Hilltop or the Commonwealth, there's someone carrying Herschel's old medical bag. Not Herschel, he's gone, lost to the brutality of the world he tried so hard to preserve humanity within, but someone who learned from him, or learned from someone who learned from him. The bag is worn, patched, held together with improvised repairs. Inside, no antibiotics or modern medications. Instead, herbs carefully labeled, natural remedies preserved and stored, the accumulated knowledge of pre-pharmaceutical healing. This is what medical knowledge looks like now. Not textbooks and prescription pads, but practical wisdom about which plants help with fever, which can be used for pain, which might prevent infection if applied to wounds. It's not ideal, It's not what anyone trained in modern medicine would choose, but it's what's possible, and so it's what survives. Maybe survival was always about remembering what our ancestors knew before pills, before pharmaceutical companies, and FDA approval and clinical trials. Back when medicine meant knowing which bark to chew for pain, which leaves to make into poultices for wounds, which roots to brew into tea for fever. That knowledge sustained humanity for millennia. Maybe it can sustain us again. The medication is gone, but the will to heal remains. The tools have changed, but the purpose hasn't. People still get sick. People still need care. And other people still step forward to provide that care, even when the tools they have are inadequate to the task. That's not failure. That's humanity. That's the stubborn refusal to accept that just because we've lost something, we've lost everything. We adapt. We remember. We pass forward what we can, hoping that someday someone might have the chance to do better. The timer counted down. The last pill was used. The medication ran out. And yet somehow, people still survive. Not comfortably, not without loss, but they survive. And maybe that's enough.